Hey everybody, this is Dr. Daniel Choi here at North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center. I wanted to talk about a video that, in this video, I wanted to talk about a topic which, if you're anything like me, you're obviously watching this video because you may be interested in getting some sort of dental implants here in the future. But if you're anything like me, you're probably thinking, all right, what can go wrong? So, just a little background information about myself. This is my 11th year of practice. I am a board certified periodontist. We're trained in placing dental implants. And I do all sorts of surgeries all day, every day. We're placing tons of dental implants. We're taking a lot of teeth, wisdom teeth. So there's a lot of procedures that we do. But, the way that, any good surgeon should think is not only what are all the things that obviously how do we get the best result, but what are the potential pitfalls? What are the things that can go wrong, and how do we prevent these issues from happening in the first place? So when it comes to dental implants, one of the most significant things that can go wrong due to lack of experience for placing dental implants, or and I want to take a step back. So how could that happen with not having enough experience? So obviously you want to make sure that you go see someone that is very experienced with placing dental implants. And that can come by making sure that that person that's going to be placing your dental implants got the proper training. Are they a specialist of some sort? Are they a prosthodontist, periodontist, oral surgeon? Those are typically the residencies that we see these people getting a lot of experience in placing dental implants. I don't want to take anything away from placing dental implants, but a dental implant is just a titanium screw that we place within your jawbone. It doesn't take a genius to place a dental implant within your jawbone. Obviously, I tell people it's like almost like placing a screw within the wall. We use a set of drills. We go from smaller to progressively larger, and basically placing, basically drilling out a hole within your jawbone. Obviously, there is a lot of complexity that you learn with more training in regards to how to deal with any sort of complications, anatomical factors that come into play, any additional bone grafting that may be necessary, any additional tissue grafting that may be necessary. And these are all little factors that become involved in regards to getting the ideal result. And those are other topics that I'll be talking about in other videos. But one of the biggest factors involved with being a good implant surgeon is by making sure that when you place your dental implant, it is at the proper depth and the proper angulation when we're placing that dental implant. So let me give you a quick little examples of what I'm talking about. So here's actually an example of a patient that came in for a consultation because he was interested in getting some crowns on top of these implants that he had placed multiple years ago. So he had 3 implants within his mouth, and then if we take a look here at the upper right, we actually see the first of his dental implants, which already has a crown on top of it. So when we take a look here, what I see is that the dental implant is within the jawbone, and definitely we have an adequate amount of bone on the outside of the implant, so that's good for the long-term prognosis. And another thing I'm really looking at is it looks like the angulation of this dental implant is pretty good. Within the same mouth, though, I don't know if it was the same surgeon that placed this implants, but what I see right here is that from this side view, this implant is not, number one, not placed at the proper angle to be, occluding with this tooth up top. And so what I'm talking about is that when we're placing dental implants, it's not just important to place a dental implant within the bone. Obviously, we got to do that from the first place. But we have to begin with the end in mind. We have to make sure that basically that dental implant is at the proper angulation so that when the teeth are coming together, I like to show people like this is like the way my knuckles are kind of coming together. Our jaws don't actually just go chomping up and down, and that's how we just chew our food. Our jaws work in a way that allow, they call it an envelope of motion in regards to like how our teeth and how the cuffs of our teeth kind of like grind together. And the way that our teeth are is that we have what we call cusps on our teeth, the pointy edges on our teeth that we see here, pointy edges and grooves. And the way that these teeth kind of like interlock with each other this envelope of motion is exactly how we grind our teeth together and chew that food into small little pieces so we can swallow. If we place a dental implant and one tooth is here and another tooth is like here, not in the proper space in the bone, or if you're looking at it from the side, if we're like this and I'm placing the dental implant in a place where it's not going to be occluding or making contact with the other tooth, opposing tooth, that's essentially a useless implant, right? So that's why it's very important that someone who might place a dental implant within the bone say, great, it looks great, and that patient didn't have enough bone in the first place, and they placed that dental implant where the bone was. But when they're trying to chew, they're like, "What? Wait, what the heck? How is it that I'm not able to chew against there?" It's well, that's a critical mistake that happens sometimes due to the lack of bone. So maybe there needed to be some bone grafting there in the first place. So just wanted to let you know in regards to like one of the things that can happen in a case like that. So in a case like this, I see that this person places implant at a very improper angle. We could adjust this with something called a custom abutment, but and I could talk about that in a different video. But one of the things I see here is that this dental implant isn't even in the bone right here. So this is a big factor. And when this patient came in and said, "Hey, can I get some crowns on these implants here?" I told him, in all honesty, and again, this is the back implant here. It's not even within the bone, just an edge of it is. I told him, look, these are your molars. You're going to be putting a lot of forces on these teeth when you're chewing, and there's no way in hell that I can put crowns on these in good conscience, because the chances are is that when you start actually chewing on these, because so much of that dental implant is not within the bone, chances are that when you put some forces on there, that those dental implants will come out. A long story short, you're going to spend thousands of dollars on those abutments and crowns, and you are going to probably have issues here within the next 6 to 12 months, and you won't be having a good long-term prognosis for those dental implants. So let me give you a few other examples of angulation issues with dental implants. Here's a patient that had a dental implant placed here on the lower right, tooth number 30. It's the first molar. The implant was placed way too high. Let's take a look at the angulation. This is the 3D scan. Honestly, this angulation is actually not bad. The problem is that this patient, because this surgeon placed the implant way too high, which I understand why they were trying to avoid the nerve, but if they had the 3D scan in the first place, they would have known that they had plenty more space to go before they hit the nerve. But long story short, what that caused was that when that implant was sticking up too far, here's this example, that if this implant was sticking up too far, it didn't give enough space for this abutment, this silver piece, and the crown that goes on top of it. So because it was, normally your upper tooth is here, and normally your lower tooth is here, but because the implant was too high, it basically was now up here. And because that upper tooth was already at the same level, they had to compensate. The dentist had to compensate by making the abutment and the crown shorter. As a result of the abutment and crown being shorter, what ended up happening is the tooth kept on breaking off over multiple times. This patient spent, I feel terrible for her. She spent thousands of dollars on this thing that kept on breaking off, and she was so frustrated that she came to me for seeking options. And I told her, unfortunately, the only option we had at that point was to basically remove the dental implant and kind of start over. Here, let me give you another example here. Here's an example of a patient who had a dental implant placed here. Definitely too high and at the wrong angle. This implant essentially is unrestorable. So this patient spent thousands of dollars on an implant that she couldn't even use. Here's a final example of a patient who was getting a snap-on denture. And I hated to tell this patient after they spent $10,000 that these implants, this patient had lost several implants, all within a month. They were just falling out of his mouth. Unfortunately, he had a complicated medical health history, and the dentist who placed these dental implants just did not know what, essentially, I hate to say it, he didn't know what he was doing. He didn't place the implants at the proper angulation and depth, and therefore the patient was developing infections, and the snap-on dentures that he thought he was getting didn't even fit properly in the first place. So, these are just small little examples why it is really important to make sure that you go to somebody that has a lot of experience in placing dental implants, and also that, just to prevent having an issue where, because we have to think about the worst case issues. What are they? Well, your dental implant can fail. You're spending thousands of dollars on a dental implant that you're thinking might last a lifetime. It'll start developing issues. But also you can have aesthetic nightmare situations too, where again you're paying thousands of dollars. You obviously want the best result. So hopefully this information was helpful. If you guys have any questions, please feel free to leave some comments below, and I'll be more than happy to help you guys. Thanks.